There's currently no effective screening for ovarian cancer. We have done many studies over the last 2 decades that have used ultrasound of the pelvis, the ovaries, CN25 tumor marker levels, pelvic exams. Unfortunately, none of those modalities has shown that we can detect ovarian cancers early enough in enough patients to decrease the mortality of ovarian cancer. We have in development now a number of technologies that I think are extremely exciting and promising. Cell-free DNA assays, for example, could be blood tests that might show us the early development of ovarian cancers. Tumor cells shed DNA into the bloodstream, and that tumor DNA is mutated. We can find these mutations in cell-free DNA because the blood test might be able to tell us this. I think there are a lot of investigators that have focused on trying to improve upon these tests and their sensitivity. It would be my, I think, prediction that we will find most likely a test based on the cell-free DNA that will, at least in a certain group of ovarian cancer patients, be a screening test. I think the second modality is improved ultrasound technologies. There are studies ongoing in the United States at my own institution that will look at whether we can refine ultrasound technologies to image ovaries and fallopian tubes in a way that is more sensitive to detect ovarian cancer and more specific. We do find a fair amount of abnormalities on what turns out to be normal ovary, but we do not, based on ultrasound, have a good way of predicting whether those findings on ultrasounds are clearly indicative of cancer or not. And here is where those new technologies are really going to become very handy. So if we can make ultrasounds more specific, meaning if we see a lesion cyst on the ovary, if that ultrasound can tell us this is likely, very likely cancer, then we can intervene earlier.